Vaginal discharge can be many colors. Different discharge colors can indicate different health conditions such as infections and menstruation. What is vaginal discharge? Vaginal discharge is fluid secreted from tiny glands in the vagina and cervix. This fluid leaks from the vagina each day to remove old cells and debris, keeping the vagina and reproductive tract clean and healthy. The amount of vaginal discharge can vary significantly from person to person. The color, consistency, and amount can also change from day to day, depending on where a person is in their menstrual cycle. Days 1 to 5. At the beginning of the cycle, discharge is usually red or bloody, as the body sheds the uterine lining. Days 6 to 14. Following a period, a person may notice less vaginal discharge than usual. As the egg starts to develop and mature, the cervical mucus will become cloudy and white or yellow. It may feel sticky. Days 14 to 25. A few days before ovulation, the mucus will be thin and slippery, similar to the consistency of egg whites. After ovulation, the mucus will go back to being cloudy, white or yellow, and possibly sticky or tacky. Days 25 to 28. The cervical mucus will lighten, and a person will see less of it, before getting another period. 1. Red vaginal discharge. The shade of red can vary from bright to a dark rust color. Red discharge is most commonly the result of bleeding during a period. Menstrual bleeding happens, on average, around every 28 days, though the normal range between 21 and 35 days. A period typically lasts for 3 to 5 days. Anyone who experiences bleeding between menstrual periods should see a doctor. Though there are many benign causes of intermenstrual bleeding, it can sometimes signal a serious condition. Anyone who has gone through menopause and not had a period for at least 1 year should see a doctor if they experience vaginal bleeding. It can sometimes be a sign of endometrial cancer, cervical cancer, and other malignant conditions. 2. White vaginal discharge. The shade of white can extend to include cream or light yellow. If a person has no other symptoms, white discharge is most likely a sign of healthy lubrication. However, if the white discharge has a consistency like cottage cheese or is accompanied by a strong odor, it can indicate an infection. White, thick and strong-smelling discharge is usually associated with a yeast infection, which can also cause itching or irritation. 3. Yellow-green vaginal discharge. If the discharge has a very slight yellow hue, it may not indicate a problem. This is especially likely if the hue only coincides with a change in diet or dietary supplements. Discharge that is a darker shade of yellow, yellowish-green, or green usually signals a bacterial or sexually transmitted infection. See a doctor promptly if vaginal discharge is thick or clumpy, or it has a foul odor. 4. Pink vaginal discharge. Discharge can be light or a much deeper pink. It usually contains a little bit of blood. Pink discharge most commonly occurs with spotting before a period. However, it can also be a sign of implantation bleeding in early pregnancy. Some people experience a little bit of spotting after ovulation, which can also cause pink discharge. Discharge can be pink after sexual intercourse if the sex has caused small tears or irritation in the vagina or cervix. 5. Clear vaginal discharge. Most ordinary vaginal discharge is clear or whitish. It may be slippery or have the consistency of egg whites. A person is likely to experience more clear, slippery discharge just before ovulation, during sexual arousal, and during pregnancy. 6. Gray vaginal discharge. Gray vaginal discharge is not healthy, and it can be a symptom of a common bacterial infection called bacterial vaginosis. Bacterial vaginosis usually causes other vaginal symptoms as well, including itching, irritation, a strong odor, redness around the vulva or vaginal opening. Anyone with gray discharge should promptly see a doctor. Following diagnosis, the doctor will usually prescribe antibiotics to treat the bacterial vaginosis. Causes of heavy vaginal discharge. Regular vaginal discharge is a sign of a healthy female reproductive system. Excess vaginal discharge can occur due to arousal, ovulation, or infections. Normal vaginal discharge contains a mixture of cervical mucus, vaginal fluid, dead cells, and bacteria. Females may experience heavy vaginal discharge from arousal or during ovulation. Now let's discuss why someone may have heavy vaginal discharge and what they can do about it. 1. Arousal. Sexual arousal triggers several physical responses in the body. Arousal increases blood flow in the genitals. As a result, the blood vessels enlarge, which pushes fluid to the surface of the vaginal walls. Arousal fluid is clear and watery with a slippery texture. This fluid helps lubricate the vagina during sex. Other signs of female arousal include increased heart rate and breathing, flushing of the face, neck, and chest, swelling of the breasts, erect nipples. 2. Ovulation. Cervical fluid is a gel-like liquid that contains proteins, carbohydrates, and amino acids. The texture and amount of cervical fluid both change throughout a female's menstrual cycle. For example, after menstruation, cervical fluid has a thick, mucus-like texture. It can be cloudy, white, or yellow. Estrogen levels increase closer to ovulation. This causes the cervical fluid to become clear and slippery, similar to that of raw egg whites. Cervical fluid discharge increases during the days leading up to ovulation and decreases after ovulation. Females may have no discharge for a few days after their period. 3. Hormonal imbalances. Hormonal imbalances related to stress, diet, or underlying medical conditions can cause heavier vaginal discharge. Polycystic ovary syndrome (PCOS), for example, refers to a set of symptoms that occur as a result of hormonal imbalances. According to the Centers for Disease Control and Prevention (CDC), PCOS affects up to 5 million females. Those with PCOS have higher levels of male hormones called androgens. Increased androgen levels can change the amount or texture of cervical fluid, cause irregular periods, prevent ovulation. Not everyone with PCOS will have increased vaginal discharge. Some other symptoms of PCOS include fewer than 8 periods, or periods that occur every roughly 21 days. Excess facial and body hair. Thinning hair or hair loss. Acne on the face and body. Weight gain. Darkening of the skin on the neck. Skin tags on the armpits or neck. Hormonal birth control, such as birth control pills and intrauterine devices, can also cause increased vaginal discharge, especially during the first few months of use. Excess vaginal discharge and other symptoms, such as spotting and cramping, usually resolve once the body adjusts to the hormonal birth control. 4. Vaginitis. Vaginitis refers to inflammation of the vagina, which can occur from an infection or irritation due to factors such as douches, lubricants, and ill-fitting clothing. Vaginitis can cause thick vaginal discharge that may be white, gray, yellow, or green. Other symptoms of vaginitis include foul vaginal odor, an itching or burning sensation in the genital area, redness or inflammation of the vagina, pain or discomfort when urinating, and pain during sexual intercourse. 5. Bacterial vaginosis. Bacterial vaginosis is a condition that results from an overgrowth of bacteria in the vagina. This vaginal infection is the most common among females aged 15 to 44 years. The exact cause of bacterial vaginosis remains unclear. Females can develop bacterial vaginosis after sexual intercourse. However, this condition is not a sexually transmitted infection (STI). Those who have bacterial vaginosis may notice a milky or gray-colored vaginal discharge. Some also report a strong, fishy vaginal odor, especially after sexual intercourse. Bacterial vaginosis can also cause discomfort when urinating, painful burning or itching in the vagina, irritation of the skin around the vagina. 6. Yeast infection. Vaginal yeast infections result from an overgrowth of the Candida fungus. Females of all ages can develop a vaginal yeast infection, and nearly 70% will have a yeast infection at some point in their lives. The most common symptom of a vaginal yeast infection is an intense itching in the vagina and vulva. Vaginal yeast infections can also cause an odorless vaginal discharge that looks similar to cottage cheese. Vaginal yeast infections are treatable at home using over-the-counter antifungal ointments. Symptoms should improve within a few days. However, severe infections can last longer and may require medical treatment. 7. Trichomoniasis. Trichomoniasis is a sexually transmitted infection caused by a parasite. Females can develop trichomoniasis after having sex with someone who has the parasite. Although most people who have trichomoniasis do not experience symptoms, some may have an itching or burning sensation in the genital area. Trichomoniasis infections can also cause excess vaginal discharge that has a foul or fishy odor and a white, yellow, or green color. It may also be thinner than usual. What is healthy discharge? Healthy vaginal discharge varies from person to person. It also changes throughout their menstrual cycle. In general, healthy vaginal discharge can appear thin and watery or thick and cloudy. Clear, white, or off-white vaginal discharge is also perfectly normal. Some females may have brown, red, or black vaginal discharge at the end of their menstrual periods if their vaginal discharge still contains blood from the uterus. Natural hormonal changes during ovulation can cause an increase in vaginal discharge, which should return to normal after ovulation. Tips for managing heavy vaginal discharge. Even healthy vaginal discharge can cause discomfort at times. Here are some tips for managing heavy vaginal discharge. 1. Wear panty liners. However, be sure not to let them become too moist, as this can increase the risk of urinary tract infections and vaginitis. 2. Choose breathable underwear made from natural fibers such as cotton. 3. Avoid wearing tight pants. 4. Avoid using hygiene products that contain added fragrances, coloring agents, or other harsh chemicals. 5. Keep the genital area clean and dry. 6. Wipe from the front to the back when using the bathroom. If you have any comments or questions, let us know in the comment box. Thank you for watching. And do not forget to subscribe our health education channel.